views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Good evening. I am Errol Schneer, Bronx Lebanon Hospital Center's Vice President of Planning, Marketing, and Public Relations, your co-host for tonight's Healthbeat television program. We welcome you, our many viewers, and as always, encourage you to continue participating in the program by calling 718-960-7261 with any questions you may have. That's 718-960-7261. And we promise to do our very best to keep you medically informed and healthy by discussing the topics that are of interest to you. Please tune in every Monday evening from 6:30 to 7 on Channel 67, and you can also find out more information about Bronx Lebanon and its many community services online at our website, bronxcare.org. Tonight, my co-host, Dr. Milton Gums, Bronx Lebanon's Vice President and Medical Director, and I will be discussing foot problems with an emphasis on treatment and prevention.
Yes, Errol, foot problems are a great concern for many of us. Some foot problems can be easily treated, while others require more complex intervention and follow-up. Joining us this evening are two experts in the field who will certainly keep us moving in the right direction. Dr. Jason Lacker is an attending podiatrist at Bronx Lebanon Hospital with extensive experience and expertise in the foot care field. David Rivera is an orthotist that is also very experienced in assisting podiatrists such as Dr. Lacker, as well as the patients.
Okay. Now, before we hear from you, our panelists, let me once again encourage you, our viewers, to call in with any questions or comments you may have. The number to call is 718-960-7261, and please call us. Now, Dr. Lacker, let me start the program by asking you to share with our viewers the definition of podiatry, as well as also tell them what type of training is involved in becoming a podiatrist.
Sure. A podiatrist is a doctor specializing in the treatment of foot and ankle problems. It requires 4 years of training in a podiatry school, followed by a 1 to 4 year residency program.
Right.
After which you are licensed to treat problems in the foot and ankle. Problems can range from something as simple as skin conditions of the foot, skin and nail conditions of the foot, to fractures, to severe infections requiring surgery.
Okay.
You sort of jumped on my question, but I'll repeat some of it. Can you expand on the disorders, the range of problems that foot and ankle are concerned?
Sure. Like I said, the most simple conditions that podiatrists generally treat are skin conditions, skin disorders, and nail disorders.
Okay.
And also very, very severe conditions, abscesses and foot infections, which require surgery and
repeated surgeries.
Repeated surgery,
Yeah.
Absolutely.
Yeah.
Okay. Now, moving to you, Mr. Rivera, what is the function of an orthotic assistant and fitter?
Okay, what an orthotic assistant and fitter does is we get prescriptions from the doctors, the podiatrists.
Right.
And let's say the patient comes in and he has a heel spur. So the doctor will prescribe either a night splint for the heel spur, or, depending on what the patient has. Sometimes the patient's diabetics. And if the patient's diabetics and have neuropathy of the foot, they will prescribe diabetic shoes.
Right.
Neuropathy?
Neuropathy.
What does that mean?
Neuropathy.
I know, what does it mean?
Oh, neuropathy is when a patient has diabetes, and some patients that have, all patients that have neuropathy of their feet, they don't feel that they have a tingly sensation on the bottom of their feet.
There's a commercial on TV about that.
Right. I haven't seen that one.
Now, in terms of the training, and experience. Perhaps you can share that with our viewers as well.
With the training, it's a course that you have to take. It's not like a year course or nothing like that. It's a course. It's a 1-week course, and you have to take an exam.
Right.
And the name of the course, I think it's BOC, is the people that teach the course.
Right.
And you have to take the course, and then after the course you take an exam, but then you have to take another exam which will certify you to become an orthotic fitter.
Okay.
So.
Okay, I'm sure that many of our viewers have experienced what they will term sore feet. Just what causes the problem, and in the first place, and what can be done to relieve it. This seems to be a big problem for some of our patients.
Right.
Sure. First thing that people need to know is that you should be able to walk all day on your feet and not be complaining about sore feet at the end of the day. If you are complaining about sore feet at the end of the day, it is an indication that there is a problem.
Right.
So
what do you do?
Yes.
Ranges.
So normally the most subtle problems that occur are subtle deformities in the shape of the foot,
Right.
which put more pressure on one area of the foot than another area. And this is where I work closely with Mr. Rivera in prescribing those orthotics, which I sometimes will give a very specific prescription, asking to offload pressure from one area of the foot and put more pressure on another area of the foot, and Mr. Rivera will take that prescription and make it happen.
Okay.
And that is often all that is needed.
Okay. Now turning back to you, Mr. Rivera, how would you describe a typical day in your life at the Bronx Lebanon Department of Podiatry?
It ranges. Every day it's something different, but it's very rewarding.
What types of patients come in, for example?
We get all sorts of patients. We get all types of patients. Sometimes we have amputations. Some patients are amputees. We get a lot of diabetic patients. We get a lot of ankle fractures.
Right.
Yeah. We get a range of patients that have podiatry problems with their feet. So it's never the same.
This is not a one-day visit. These are patients who come back for months.
Months.
And probably more.
Right,
Yeah.
right. They come back. You know, we see, I know every single patient that walks into that door because we see them at least once or twice a week. So, I mean, the typical day in Bronx Lebanon Orthopedics, it's great. I mean, it's rewarding to me to actually see the patient walking away from the clinic with something that's going to help them.
Moving from the sore feet to heels that hurt, lead me to ask you, how this problem addressed, the heels? That's a problem, right? Yeah.
Sure. So heel pain typically comes from also usually a deformity in the foot, which leads to a tightening of the ligament on the bottom of the foot,
Right.
and a pulling of that ligament on the heel itself, which can cause inflammation in that area, and that causes the pain in that area.
Yeah.
There are many, many treatments.
Tell me the simplest and then range up a little
Sure.
bit. Yeah.
The simplest treatment involves a series of stretching exercises to stretch out those ligaments.
Right.
That has to be done by somebody else.
No. We typically, if you come into our clinic, I will first give you a sheet with the stretching exercises.
Okay.
And also a prescription for an orthotic to hold the foot in the proper place. And usually also a anti-inflammatory pill. That is the first line of treatment that I generally prescribe.
For how long?
I usually have the patients come back within 2 to 3 weeks, and many times, I'd say about 80 to 85% of the time, that is all the treatment that is needed, and their heel pain is gone. If they are still complaining of pain at that time, then I will offer the patient an injection, which is also consists of an anti-inflammatory steroid and an anesthetic. But they have to know that they also have to continue with the stretching exercises because to address the real underlying cause of the problem, you need to stretch that ligament out.
Okay. On another note, what does it mean when toenails are discolored?
Okay.
That's another common problem,
Sure,
correct?
sure. Toenail discoloration is most commonly caused by a fungus infection, and that fungus infection can be caused by many different things. Many times, people with improperly fitting shoes,
Right.
they do damage to their nails without even realizing it. And once the nail is lifted off the nail bed, the fungus will get in there. And there are many, many treatments for fungus infection. I generally start with topical creams, solutions, and powders.
Right.
One thing that patients have to be aware of is if you're treating the foot for a fungal infection, you must also treat the shoes and the socks that the foot goes into. Because
Otherwise, it's recurrent.
Right, it just recurs, and people don't know why they're still having this problem.
Right.
If it's very, very persistent, I then will go ahead and prescribe an oral antifungal. And
Okay, I'm going to interrupt you a second. We have a call.
Albert, you have a call. You have a call for us, Albert.
Yes, thank you, Dr. Gums.
Okay, let's get your question.
For almost about 15 years, I was an amateur and professional boxer. And my style of boxing was similar to the great Muhammad Ali, who we just recently lost. I was constantly on my balls or my feet. There's not a day that doesn't go by that the balls of my feet, I have like a burning sensation. And it's become very, very quite annoying as I'm getting older.
Okay, let's hear if we can treat that. Let's hear. Albert was a professional boxer.
okay,
Like he said, almost as good as Muhammad. He
Muhammad
said,
Ali, yeah.
and he has spent a lot of time on his heels,
okay,
and he has pain.
okay.
So
No, actually on the balls of my feet.
on the balls of your
Balls of the feet,
Yeah.
different.
Yeah. Okay. Yeah.
Okay, repetitive trauma to the balls of the feet,
Yeah.
just as like bouncing around
Yeah.
for a boxing match.
Yeah.
The camera and answer.
Sure. Repetitive trauma, bouncing around on the balls of your feet professionally, that causes micro trauma to the bones. You could have chronic inflammation in the joints,
foot.
which can be treated also with anti-inflammatories, also with injections, and with accommodative shoe gear. In order to fully treat and diagnose you, I would have to take an X-ray and perhaps some further studies to fully understand.
But there's
and
options
appreciate.
out there for him.
There's definitely options out there.
And treatment. And you'd be glad to see him.
I would definitely be
Okay.
glad to see
Yeah.
you.
Okay.
And we
Thank you
also-
very much, Albert. We have another question. Laurie, let's get your question. Laurie, it's gone. Okay,
we
she'll
lost
probably
her.
come back. Okay.
Okay.
Yeah. Do you want to say anything else about the heel? Yeah.
About
That you're ready.
the ball of the
Yeah.
foot. Sure. Yeah.
Go ahead.
So first, we would need to get an X-ray evaluation to see exactly if there is any trauma to the bone that's detectable on the X-ray, and then we would further know how to treat that problem.
Okay. All right. Thank you very
Now,
much, Albert, for the question.
is there any
okay,
relation-
Laurie's
oh,
back.
Laurie's
Laurie,
back. Go
you have
ahead.
a question for us.
Hi, yes, I did have a question. So I just ran in a half marathon,
Half-
and I started to feel some pain in my foot immediately after. It's in my left foot, and it's kind of on my heel, a little bit on my arch as well. It's a shocking pain. Every single time I step down, it gets worse. I can't really walk right now. I have a little bit of a limp, and I just want to know what exactly it is and what I can do to help treat it. I'm not sure if it's from the marathon or if it's from something else. I do have high arches on my feet,
Okay.
so I don't know if that attributes
Okay, you're shaking your head. You hear the question?
Yes.
Okay, Laurie, let him answer.
It's a question I deal with often in my practice, especially with marathon runners. You most likely have a small injury to the ligaments or the tendons in the foot, which
Okay.
would require wrapping and splinting. Just general rest is very important. Icing is very important also, to stay off of it for a few days and just complete rest for a few days and see how that goes.
Okay.
And how do you think I did it? Just from the pressure, from the
Ju-
running?
Yes, a half marathon, that's 13.5 miles, right?
Yeah.
That's a lot of miles to put on your feet. And you did say you have high arches?
Yes, I do.
Yes, which puts extra stress on the foot that really would be distributed differently if your arches weren't high.
Okay.
Okay.
Okay, Laurie, thank you very much for the question.
Thank you so
Now,
much.
another question that comes up, is there any relationship between smoking, alcohol, or even diet on foot problems?
Absolutely. And that relationship is one of circulation. Smoking definitely affects the circulation, especially the small circulation in the toes and in the lower extremities. And with poor circulation, you get a whole host of problems, healing issues, and such.
Okay. On that note, let's pause for a short break, and when we return, we will continue our discussion and also take calls from you, our viewers. Once again, the number to call is 718-960-7261. That's 718-960-7261, and please call us.
In this age of technology, Bronx Lebanon Hospital Center is advancing computer systems to benefit its patients and the community.
What is really important is that the technology we provide is truly helping the community. And as a result, our physicians, nurses, and staff are really succeeding in optimizing patients' care and access, as well as patient safety and satisfaction.
Our staff relies on the comprehensive health information systems we have in place to expedite the registration process and make the appropriate medical decisions regarding treatment and follow-up care.
At Bronx Lebanon, highly specialized care is being provided by an expert staff using state-of-the-art technology. Bronx Lebanon surgeons are also at the forefront of advancing technology.
We certainly have cutting-edge technologies in place, but what is especially important here is that we have surgeons, nurses, and technicians who deeply care about our patients.
Bronx Lebanon's ear, nose, and throat department is also performing highly complex surgical procedures.
We are bringing all types of technological advances to our ENT patients, including the latest in facial plastic and reconstructive surgery, designed to achieve successful outcomes.
And Bronx Lebanon's orthopedic team is keeping patients moving in the right direction.
We have leveraged our own patient outcomes data as well as national studies to achieve the highest level of care in hip and knee replacements. Our spine, hand, and foot surgery, as well as sports medicine programs, continue to be of the highest caliber.
Extraordinary is the best way to describe the sight-saving surgeries performed by Bronx Lebanon's ophthalmologists.
We are using sophisticated laser and complex surgical procedures, as well as microscopic technologies to protect and restore vision.
Bronx Lebanon is also delivering exceptional services for women. Its one-stop shopping approach means easy access to a wide range of general and specialized inpatient and outpatient OB/GYN services.
We provide women in the community with a luxurious birthing spa in a state-of-the-art labor and delivery unit and comprehensive outpatient GYN services at the hospital's new Health and Wellness Center. When necessary, advanced robotic surgery and other related procedures are available.
In the ER, we see some of the most dramatic examples of Bronx Lebanon's staff and technology in action.
Our expert and experienced ER team is helping patients overcome all types of emergencies. We are effectively using high-tech equipment to monitor, track, and evaluate a patient's condition prior to making the decision to admit, discharge, or extend their observation in our recently completed 11-bay unit.
And technological advances are changing the practice of nursing.
Our nurses are fully prepared and eager to meet the challenges and benefits that technology has to offer. We are now using an electronic medical record, which is providing nurses with the time to do what they do best, provide excellent care for our patients.
Bronx Lebanon is also leading the way in anesthesiology, dentistry, family medicine, neonatology, neurosurgery, pediatrics, psychiatry, and long-term care.
Welcome back to Healthbeat. We come to you live on BronxNet every Monday evening from 6:30 to 7 p.m. Please call us at 718-960-7261 with any questions you may have, and we will certainly do our best to answer them. That's 718-960-7261. Now let's continue our discussion. Now, we often ask our panelists to share their career pathways with our viewers. And I'll start with you, Mr. Rivera. What led you to become an orthotist?
Well, what led me to become an orthotic fitter was working at Bronx Lebanon and working in the Department of Orthopedics. It became almost like a love to me to work there and treat these patients that I noticed 90% of patients here in the neighborhood have these issues, and it became like a love for me to actually help these people, because these problems, they can suffer from mild to very severe, and it's a passion to me to at least help them and let them go about their daily life normal.
Okay. And how about you, Dr. Lacker?
Sure. My journey to podiatry is a very personal one. I was born with a circulation problem that affected my right leg, and because of that, I was treated extensively, and I suffered from a lot of foot infections growing up. And it brought home to me the importance of, first of all, preventative care, and as something that I saw that with the proper treatment and the proper education, patients can really, really be helped to prevent all sorts of problems. And it really gave me the push to pursue a career in podiatry.
Okay.
Yeah. Well, I didn't know about your personal history, but I'll ask you a question that continues that a little bit. Poor circulation impacts a patient.
Sure.
What about a diabetic patient?
Sure.
Just a minute. Donna, you have a question? Donna?
Yes?
You have a question?
Yes, I do. If you have metatarsals that you have put in your sneakers daily, but your toes are still going numb on one foot, what else can be done? I heard through a friend that you could get a shot in your toes or underneath to make it feel better. Do you agree with that?
You heard the question.
I heard the question.
Good.
Sure. First of all, you're saying that you have pain in one foot.
Yes, the left foot.
And you've been wearing these orthotics, and they haven't been helping that one foot.
Nope, they haven't been helping at all. My toes on my left foot are still going numb, and I don't know what else to do.
Okay, so there are definitely conditions that will cause the toes to go numb. Specifically in the foot, there's a condition called a neuroma, which is an inflammation of the nerve that runs between the metatarsal bones. And we do give injections to treat that type of pain. In order for that to happen, we'd have to make sure that that is what we were treating. There are other causes for numbness on one side of the body or one foot. It could be also a back issue or any type of spine issue. But if it's just in the foot and you have no other related issues such as back issues.
I do have back and spine issues, and every now and then I have to go in and get a shot in the spine. But it's not feeling like I need a shot in the spine now because it's only in the toes.
Okay, but sure, there very well could be just a specific issue in the foot, which an injection would help. However, depending on what level of the spine we're dealing with, it certainly could be becoming a spine issue as well.
Okay, so you just make an appointment to see you, and you'd be able to tell just by looking at me, or?
Absolutely, we would do evaluations on you, and I would make a diagnosis at that time.
Okay, and then if I needed a shot in the foot, you could give it right then and there.
Absolutely.
Okay, thank you very much for the question. Expanding a little on Mr. Schneer's question before, how do podiatrists such as yourself work with physician specialists who address diabetes complications, etc.?
So the diabetic patient is a very unique type of patient.
Yeah.
They're what's considered the at-risk community.
Yeah.
Because diabetics typically suffer from a condition called neuropathy, which is a nerve damage from high sugar levels.
Yeah.
They also can suffer from circulation problems, as well as a decreased ability to fight infection. So I work very, very closely with neurologists and vascular surgeons, as well as endocrinologists, to come up with a comprehensive plan for these patients.
On that note, I also want to have Mr. Rivera share with our viewers some of your success stories.
Well, I've had...
It's all of his patients.
I've had, yeah, well, that as well. I mean, I've had numerous success stories. I've had patients come in and, you know, they're diabetic patients with neuropathy, and just something simple that I gave them, whether it be a diabetic shoe or something, just to treat them with the neuropathy, and the foot not, you know, measuring this patient to the correct size of shoe. I mean, it's helped. I mean, I've seen patients that were very close to losing their toe, and they come in and they say, "Thank you so much," and they still have it. And you know, of course, with his help and my help in sizing this patient for the, you know, the right shoe size, it's helped. So.
What about you, Dr. Lacker? Very quick.
Sure. The real great successes are not necessarily the dramatic successes where patients come in with severely infected wounds and we manage to save their limb. Those are successes and they are great. But the real successes are the day-to-day education that I provide for my patients, which prevents the hospital visits and prevents those infections and ulcers in the first place.
How can the patients see you? How can the patients come to see you?
Generally, I never turn anyone away. They can come walk in and make an appointment that day and I will see them. They get referred by their primary doctors, by their endocrinologists, by their neurologists, and it's just a matter of calling to make an appointment.
Okay. On that note, let me thank you, Dr. Lacker and Mr. Rivera, for joining with Dr. Gums and myself on tonight's Healthbeat television program. And most importantly, let me thank you, our viewers, for tuning in this evening.
If you, our viewers, have any questions or need assistance, I encourage you to call our physician referral service by dialing 718-99-BRONX. That is 718-992-7669. Or you can refer to our website at bronxcare.org. Good night.
There's a shelter pet who wants to meet you. Meet one today. Visit theshelterpetproject.org. Adopt.
You sure you don't want some? It's chamomile. Listen, you are extremely terrifying. Just the scariest undead subhuman thing on TV, and I really mean that. But I am worried that you could give my kids nightmares if they see you, so I'm gonna have to block you. So that's it. Oh, and tell the zombies they're blocked too.
Hey, Mom. I got the job.
You've got the job. Welcome aboard.
I've got a job to do today.
Have a good first day at work, Mom.
Donate to Goodwill. Help provide job training in your community.
Today, 1 out of every 4 American kids is Hispanic. That means many of the future doctors who will care for us, the engineers who will build our cities,